A very good evening to one and all present here today for the wonderful session for Telemedicon 2022, strengthening health system through sustainable telemedicine and digital health in collaboration with the Telemedicine Society of Kerala and Amrita Hospitals. Today, I'm really honored to invite Mr. Bijoy MG, Chairperson for Telemedicon 2022, to give the highlights about the main event, Telemedicon 2022. Over to you, sir.
Thank you. Good evening to all. Welcome to the Prelude session of Telemedicon 2022. As many of you might have already registered for the conference, this is Telemedicon. It's an annual international conference of Telemedicine Society of India. So this 3-day conference of scientific sessions, including scientific sessions, starts on 10th to 12th at Amrita Hospital, Cochin. So the speakers from across the world are participating, and that includes the World Health Organization also supporting us. So we have got around 2 to 3 speakers from World Health Organization also speaking in this event, and we have got research papers, and that will be published. And unfortunately, that our chief guest for this event is our chairman of ISRO. So I welcome you all to the conference, and for doctors we have a announcement that our Kerala State Medical Council as giving 4 credit points for the doctors who are attending the conference for the 3 scientific sessions. So I welcome you all to join at Cochin, and we have our website for registration, that is telemedicon2022.com. And once again, I welcome you all, and over to Nita, Dr. Nita. Thank you.
Good evening, one and all. It's my pleasure to invite the eminent speakers. We are lucky to have 2 eminent speakers with us, Dr. Umashankar as well as Dr. Rajesh Deepai. I first invite Dr. Umashankar, who is the secretary of our Bangalore chapter of TSI, and he is executive committee member of TSI National Committee, and he always supports us Kerala chapter in all activities of TSI Kerala chapter, and he is the principal of Padma Shri School of Public Health, Bangalore, and as well as he is managing director of MedPort, and he will be handling a session on how to implement telemedicine in daily practice. And I welcome you, sir, for the session, and I hand over to sir for taking the first session. Thank you, sir. Thank you.
Thank you, Dr. Nita, for inviting me here for this particular session, and I'm really excited to be part of this particular prelude session of Telemedicon 2022. Before I proceed further, I would like to wish all our participants happy Deepavali. You can see there's a lot of noise going on behind me. I would apologize for that. I have no control on that particular noise. Okay, with that note, let me go on to the session. Is the screen visible to all?
Yes, sir, visible.
Yes. So this session is about how to implement telemedicine in daily practice. So how I have planned this session is, it's going to be let's basic of telemedicine and what are the different types of telemedicine applications and the tools what we use in the practice, and what are the various telemedicine models which we can use in our day-to-day practice. This is what I have planned to discuss today in the next 15 to 20 minutes. So if we see, India is the advancing very fast, and it is one of the emerging economies, and it's also the second most populous country. when we see we are developing in most of the other fields, when we look at the healthcare, it's not very bad or it's not very good. We still need a lot of improvement in this. One of the dominant discourses in the public health, when we look at the domain where we are looking at universal health coverage, we still have shortage of adequate number of qualified medical doctors. It is more shortage in the sense it's not evenly distributed across the country. Maybe we might see a lot of people only in urban areas and other semi-urban, then rural and tier 2 and tier 3 cities, we may not have many. So when we have such kind of issues and we are advanced with technology, so one best use of is use of technology. So why do we need these kind of technologies? Because there is a divide in India, whether it's in urban or in rural area. India's doctor population ratio as on April 5th, 2022, this is the minister's version, what he said in the parliament was it is 1 doctor for 834 population. So when we have this much burden on the population, 1 doctor has so much burden, it would be very difficult for us to give quality care to the people. And efficiency and effectiveness in managing the problems may not be very good. So to reduce that kind of, you may not have doctors everywhere in all the locations. So use of technology is the best kind of a solution what we have right now. That is, the technology is telemedicine. So what is telemedicine? Most of you might have heard, actually post-COVID, this has become a day-to-day word in our society. People talk about telemedicine, and even the government has given so much of importance to telemedicine now post-COVID, because this was the only option for most of us to reach to our patients or patients to reach to their respective doctors. So what is a telemedicine? There's a big definition of telemedicine. To make it very simple, it is treating patients at a distance, where distance is a critical factor or health professional is not there. So we use communication technologies to reach to our patients, or some people say treating via wires or reaching the unreached through technology. There are so many ways in which we are describing telemedicine. Most of us practitioners might have practiced telemedicine without knowing what it is, or we might have not known that this is a telemedicine. So telemedicine practice, it is as simple as 2 doctors talking over phone. It may be a junior doctor talking to a senior specialist or to his senior and discussing about a case. That this is what I have seen, what should I do? It could be as simple as that. Or it could be as complicated as telerobotic surgery, where the patient is somewhere, doctor is somewhere, and the surgery is happening. So this is the wide spectrum of telemedicine. Okay. So in this wide spectrum, we all have our scope to practice telemedicine. So what is that? How do we practice? We will be looking at one. So in India, we see most often we use telemedicine for teleconsultation, for teleradiology, teleophthalmology, tele-ICU, telecardiology, teledermatology, telepathology, telepsychiatry. These are all the ways in which telemedicine we are using. But when it started in the US with using for the space and then for telepsychiatry later and all those things. That's how it expanded. Today's scope is expanding with the artificial intelligence coming, machine learning coming. We are going in more deeper and deeper. And today's topic, I'm not going to talk about all those things. I'm going to talk very simple. How do we use this technology in our practice? So we see here, any specialist can use telemedicine, like teleconsultation. Any consultation we can do. It is, we are doing a teleconsultation, where tele means what? Distance. You are consulting a patient at a distance. It may be radiology. So teleradiology is doing very good now, where there are a lot of companies, there are a lot of hospitals who are doing teleradiology services, where the radiologists sitting somewhere are reading the reports and giving their opinion. Then similarly, ophthalmology, teleophthalmology is doing very good. Tele-ICU today, a lot of hospitals have gone because there are very few intensivists in the country. So the few of them are actually managing the entire load of that tele-ICU. It's a very upcoming field, and it is a very promising for where we do not have the intensivist. Telecardiology has been used for a long time, and then it is like it's managed. We have seen how we have saved life in the nth moment, that just by doing an ECG and referring the patient immediately using telemedicine, and the telecardiology ECG is sent, and then the cardiologist opinion is taken and done. Similarly, teledermatology, telepathology, telepsychiatry is doing very good. The government also is doing a lot of work in the field of telepsychiatry. So like this, we are having any system of medicine, not only in allopathy, even in Ayurveda, homeopathy, Siddha, yoga, everywhere we can use the telemedicine as a tool. So telemedicine is a tool. It depends on how we use this tool, right? So how do we use it, the tool? So I put it, the telemedicine practice in 3 tiers. One is primary telemedicine, secondary telemedicine, tertiary telemedicine. Now you might ask me, what is a primary telemedicine? For me, primary telemedicine is a place where we are providing primary care to the patient. Where there is no doctor, you try to provide primary care. Maybe we take the local people and train them and then have a kiosk or something like that. We do that. So where you have a direct connect between the patient and the doctor, I call that as a primary telemedicine. Now, what is a secondary? Secondary telemedicine, it is basically between a doctor and a doctor. So you may have a specialist, you may have a general physician or a junior doctor who is asking the senior doctor how to do, what to do, and sending a report and getting the consultation. Tertiary is going further ahead, like what I told you about, providing tertiary care, maybe surgical telesurgery or something like that, teleradiology and all those things, where we are providing tertiary care. So this is a very simple way of looking at the telemedicine in these 3 layers or 3-tier system. We generally in Indian health system, we have all 3 tiers. So even here, we can talk about telemedicine in the 3-tier system. Now, what are the tools? What is available for any practitioner? What do we use? So as I told you, telemedicine is a tool. So you can use a normal telephone line, or you can use a video consultation, or nowadays, most of us during COVID, even whether we used any platform or no, we all have used any of these chat platforms, either WhatsApp or some of them have used Facebook, some of them have used so many other platforms to consult to their patients. So you can have various devices connected to your system. Maybe it can have any of the accessory systems, like maybe you may have a digital stethoscope or an ECG or an otoscope, or any point of care device which we can use that can be used. And today we have a lot of mobile apps and internet-based digital platforms which have come for the telemedicine practice. As a practitioner, we can use any of these systems what is available. As you see, there are so many varieties of the tools what we can use. Irrespective of what communication we are practicing is the same. Our main motto is to provide care to the patient. So whatever we do in in-person care, we do same using telemedicine. That's what we are supposed to do. So there are, with so many varieties, there must be some pros and cons of each, some advantages and disadvantages of all of them. There are some good things what we can use. So similarly, like chat platforms, we may not be able to have a video consultation. We may not be able to have our digital records of the patient or something. So, but it is one very simple platform where immediately we can talk to a patient, and most of the patient might have been sending, asking questions on WhatsApp, and then you might be prescribing in WhatsApp, or you may take a photograph or send or something like that. So with all these things, now with telemedicine coming in, Government of India, the National Medical Commission, or the Ministry of Health and Family Welfare came out with the guidelines, telemedicine practice guidelines. So it's good that government has kept it at vast open so that we can use any of the technologies what is available. When we see that, we should always look at one thing is what is at ease for both the patient and the doctor. What is more comfortable for them, we have to see. And then start selecting. So now if we have to use the telemedicine, we need to select, we need to know what is good for us. How do we know? We have to look at all these options, what is available for us. What is the connectivity, what we have? What facilities do we have in our clinic or in our homes? Most of the time we do practice from homes or while we're traveling. That's the beauty of having telemedicine practice, right? Even when we are traveling, we can provide consultation. Even when we are not in our clinic or in a hospital, we can provide consultation. So what facilities do we have? And what facilities do our patients have? So depending on that, we can select. We can look at all the pros and cons of each of these things, and then we can select. So how do we know what to select? For that, I'll come a little later. But before that, let's look at what are all the different types of telemedicine, or what we say classification. How do we classify various applications of telemedicine? This is, most of you might know, I'm just giving you context so that it was easy for our practice. How do we select? So based on mode of communication, we can either have a text-based communication or an audio-based or a video-based. So when we are using, like sometimes like we can use text to communicate with our patients, and similarly with our seniors or fellow colleagues, if we want to ask some kind of an opinion for. Generally, we do have, right, second opinion we take, either patient take, or we ourselves as a physicians, we might want to get some consultation from different specialists, or take a second opinion from our friends or colleagues or something like that when you are in a confused state. So it can be done either a text-based or an audio. Audio can be over phone or voice over IP. There are technologies are available, or there are various apps for audio apps also, which we, or the video, like video chat platforms, or you have various systems now. The technology platforms which are available, web-based are available. There are different cloud-based technologies which are available, which we can use. The next one is either it can be a real time, or it can be store and forward, synchronous and asynchronous. So now, what is a real time, where we can either have it audio, video, or text? We can chat with a patient, talk to a patient, or have an interaction live. Both patient and a doctor, or a doctor and a doctor, are having a live consultation. Asynchronous, maybe it is like store and forward, where we do not have either party, that is either a patient or a doctor is not available. What we can do is we can send all the details to the patient, can send to the doctor, or the junior doctor can send to a senior doctor. When they have time, they will look at the reports and then reply back. That is what is asynchronous exchange, where you can do when they are not, when the time constraints are there. The third one is, when do we do consultation, whether we do it for emergency or non-emergency. So it may be, it can be either first consultation or it can be a follow-up consultation. So in emergency situations, yes, we say that telemedicine can be used in emergency situation, but we have to be very cautious. We should not be going on managing the patient, emergency patient. Okay, so what we have to do, immediate first aid, advise what needs to be done, and then send the patient to the nearest center wherever it is. In non-emergency cases, you can do a routine diagnosis, you can do a treatment, you can do health education, counseling, whatever it is. It may be the first time the patient is coming via telemedicine, or it may be a follow-up consultation. So most often what happens is, especially this technology is used in the bigger hospitals for maybe medical tourism or something. Patient comes from faraway places, they do a procedure and then they send. And then instead of the patient coming every time traveling this far, so they use this telemedicine technology or teleconsultation and do the follow-up. They can have the same doctor who has treated them, and then instead of traveling, they can do. So these are based on the purpose of consultation. Next is, how do we interact? So this we will go into detail in the next few slides. So interaction between whom? So the teleconsultation can be between the patient and the doctor directly, or it can be a caregiver that patient is not able to do, or you may have your parents or somebody who are doing. It can be from home care, like patients are at home and the doctor is elsewhere, they can do. or it can be between a doctor and a doctor and a specialist or something like that, or you can have a health worker to a doctor, or there are health kiosks or telemedicine kiosks now that is also coming up, where it is fixed in various places where you can go to those kiosks and start consulting. Based on the interaction, we can have different types of telemedicine. So telemedicine application, you can have this major four, and if you see major four, there are different classifications which we can use these telemedicine for. So now I was talking to you about consultation, first consultation and the follow-up consultation. So what's the first consultation? First consultation is when the patient is consulting the doctor first time over telemedicine itself. Follow-up consultation, this is as per the Government of India's guidelines. If the patient is coming within 6 months, then it is considered as a follow-up consultation. Okay, or if he is coming for a new symptoms, then it is not considered as a follow-up consultation. Or if it goes beyond 6 months, it is not a follow-up consultation. So the consultation process is like that. When a patient calls a doctor or a patient approaches a physician or a doctor, when the patient initiating it, either he can initiate either through text, audio, or a video. Any of these ways they can initiate. Okay, so when a patient initiate, it is considered as a consent is implied. That means he is already giving consent for the teleconsultation. So in our day-to-day practice, we should always be sure the National Medical Commission has come out with the new guidelines about the etiquettes and practice guidelines. So we have to take a consent from the patient that he is ready for a teleconsultation. So the Government of India website, you can get all the details. Today, I'm not going to discuss about all. I'm just only here. I'm telling that there are guidelines which you have to follow. In our day-to-day practice, we have to follow those guidelines. So once the patient initiates the consultation, it is considered as it's an implied consent. Once the implied consent is then, we have to identify. The guideline says the patient and the doctor should identify each other. Okay. So now once the patient identification is done, the doctor should quickly assess whether this condition needs an emergency care or it can be done over teleconsultation. If it is an emergency care is needed, it first advise the first aid or whatever needs to be done, appropriate preference, and refer the patient immediately. Now, okay, if it is not an emergency, we have to decide whether the patient is suitable for, we should evaluate the patient, whether the patient is suitable for teleconsultation or not. So now, if it is appropriate for teleconsultation, we can start. If it is not appropriate for teleconsultation, we have to advise the patient go to a nearest hospital and take an in-person consultation. If it is an appropriate, then we can take the case or take the details and start treating, give prescription, and then even advise whatever needs to be done. So this is the entire process of teleconsultation, what we do in our day-to-day practice. This is how we have to do the practice. Now, for what all we can use telemedicine or the teleconsultation, we can prescribe medicine, we can provide health education, or we can do even counseling. So anything can be done using this technology. So there are 6 ways. How do we practice? There are 6 ways, major basic ways. Now, how do we want, maybe I'm an individual clinician and I have a clinic and I want the patients to contact me, or my own patients, or I want other patients from different places to contact me. So there are various technologies and platforms available for this. So a public platform is available, like there are many which you can get the details of it, or if you can write to us later, we can suggest you what are all the good platforms. Because most of us, we make a mistake in selecting what appropriate platform or appropriate technology for each of the scenarios. That is where most of us fail. So people will tell some of them might have used, no, telemedicine doesn't work. It has a lot of problems. The problem comes because we have not selected an appropriate tool for our practice. When you see, I told you there are different types of tools and our practices are different. So according to our practice, according to our need, according to what is the situation, we have to select a tool. Okay. So that is one way. The other way is we may have some of the doctors go different areas to different places to rural areas. So instead of you traveling, you can set up a rural telemedicine centers, or wherever you're traveling, you can have a telemedicine centers established, and you can have somebody who's trained, either a nurse or somebody locally. There are health practitioners. You can train them, and then we can have them. Telemedicine trained practitioners can be appointed there, and then you, instead of you traveling, you can have the system placed everywhere, and then you can do that. The other one is where their patient cannot reach. Sorry, the patient do not have healthcare facilities, and the doctor cannot go, and the hospitals are very far away. So we can use mobile telemedicine, where we can have a van going into different places with all the equipments, and the hospital and the doctor can connect to them. The other one is a simple where we have doctor-to-doctor consultation, a physician to another specialist or something like that. Okay, so I will discuss each of these scenarios, and for each of the scenarios, we have a different platform, different technologies, different equipments, what we need. So first I told you patient to a doctor directly. So it may be a consultation patient to a doctor. Either the patient can be at home or he can be anywhere traveling, and he can consult to a doctor, either to known doctor, or there are platforms where the doctors are listed. He can connect to any of the hospitals or any specific doctors, where they can search according to their language, according to their name, according to the specialty. However, so there are various different facilities available today. So one scenario, one model in where we can practice telemedicine daily is patient to a doctor. The second one is home health care. So today, with a lot of the life expectancy has increased in India, and we also have a lot of non-communicable disease. So patients are bedridden at home. They don't want to travel with all the traffic and all. It is unnecessary that the patient have to travel to the hospital every time. Unless and until there needs a procedure, the patient may not meet the doctor in person. That's my way of believing. Because something which we can manage at home, we should be able to manage. Because unnecessarily patient comes to a hospital and there is a lot of infections, hospital acquired infection, another complication, especially for elderly population, bedridden. We can manage at home for non-communicable disease. So home health care, that is, you can have certain equipments and even monitor the patient's vital parameters from the home. So there are equipments which we can use there. Then health worker to a doctor. So if you have a hospital, or if you want to spread your practice to rural areas, you can have a health worker going around with a kit. And then, like now, for example, ASHA workers can have their kit, or your own private health workers who are who can go to various places with a kit and connect, and then door to door that you're providing healthcare at the door services. So that is also possible. So what all this healthcare worker can carry, they can carry digital stethoscope, then they can have ECG, they can have otoscope, they can also make simple laboratory equipments. All those things can be carried in a suitcase. It's like a hospital in a suitcase kind of. So that is another third model what we can use in our practice. The other one is a doctor to a specialist. So it's not necessary that if I have to refer the patient for an opinion. Either I can send the documents to the senior consultant or to a specialist, or I can do a video call and finish the consultation immediately. If the doctor is available, then immediate consultation is possible. So that is another model what we can use in our day-to-day practice. The third one is the mobile telemedicine, where you can use, or you can have even a ICU, mobile ICU, or in emergency situation, like the technology today, we are in such a way that once the ambulance picks up the patient, before the patient comes to the hospital, the emergency physician can guide what needs to be done, and the care can start the moment the patient is put into the ambulance. So mobile telemedicine can be done. So emergency care can be provided. The other way is where hospitals, so you can have a mobile hospital going around to different places, and all the facilities what a person can get in a hospital can be taken, including the lab, including the X-ray machines, everything can go around, even diagnostics can be done, and they can consult the doctors, which is very good. Immediately they can get. The sixth model is whether the health kiosk can be there in various places. So if there is no healthcare health worker also, the patient themselves can go to the kiosk. Today, like ATMs, we have health ATMs. We just go to that kiosk, and then the patient can start. Those who know a little bit of computer or little bit of basic things, they just need to go and enter their name and then start, and then the kiosk will start working. So this is the way in which today the telemedicine delivery, there are various systems and models which we can use in our day-to-day practice. The technology is gone so much that even medicines can be prescribed and dispensed using these kind of kiosks. So we are moving. So this is patient to doctor. Whatever I spoke, it's just coming as this one. So these are the ways in which we have to do. Suppose if it's a caregiver, the caregiver, according to the government guidelines, the caregiver must have given permission for them to consult a doctor. If it is less than, if it's a minor patient, then the caregiver can formally authorize for consulting to this. So this particular situation, they needs an explicit consult opinion needs to be taken. So at the village worker, I told that health worker can go. They can do either patient care, maternal care, whatever services are needed. So we can have these all equipments can be attached and they can take care, go around places and then. So consultation between health worker and a practitioner. So the health worker can, who knows certain things, can tell the doctor what is happening, and then the doctor can prescribe according to that. So you can have a nurse or allied health professionals who can be taken as a health worker. So this is between a doctor and a specialist. In emergency situation, we can see the situation and then refer the patient. This is another way. And mobile telemedicine, I told you, and also you can have a kiosk. Okay, so these are the different ways in which we can practice. So telemedicine can be used for any condition, provided it is not an emergency, provided it is that the patient and the doctor need not be in person for any kind of procedures. Other than that, telemedicine can be used, but it has to be used judiciously. So that is what any tool what we have, if we do not use it appropriately, then that's going to give a trouble. So we will have to manage that. So always we should know how to use. Now, how do we decide what to do? You can consult the people, doctors can consult and appropriate. There are a lot of experts today who are aware of all these facilities and what are all the technologies are available, what technology would be suiting to your particular region. It again, why I'm telling your region and area is because it all depends on the connectivity. It all depends on what can be used. So there are, what has happened, what I have seen is, we say that we have an app, I can use this everything in the app. There are a lot of apps, but at the patient in the rural area may not be able to use those apps. So for them, it is always better if they can go to a center or if they have a health worker to do. Otherwise, it is very difficult. So there are technology. So we have to select an appropriate technology. It is not that one technology fits for every situation. So that is where we have to use our knowledge and then suggest or adapt those technologies what is required for us. Okay. So in the rural telemedicine, you can have so many different equipments which we can place, stethoscope, thermometer, digital BP apparatus, ECG, otoscope, ophthalmoscope, pulse oximeter, and you can have a mini pharmacy, and even you can have a small dressing facility also where it can be done. Okay, or you can have connection, a big network. If you have a super specialty hospital, you can connect to smaller hospital, you can connect to rural networks, you can have a remote ICU where the your super specialty hospital may have intensive it, but in remote areas we may not always have intensivist. So we can connect and manage those patients from remotely. The intensivist can manage and monitor them. The technology is so advanced today that intensivists can manage 30 to 40 patients at a time. So that's the way we are moving forward with the digital technology. So it can be, so the other one is, it can be either multiple specialties, or you can use any single specialty also. Like it's only ophthalmology, it's only radiology, or radio diagnosis or something like that, or it can be cardiology, no, or you can use a multi-specialty, any specialty. So each one of them have their own pros and cons, and how to use, we should know about these things. So just to conclude, so what I would say is capitalize on the potential of the telemedicine in our day-to-day practice. It's a very good tool if used appropriately. So we should practice as per the guidelines. So the telemedicine is the solution which can deliver right healthcare to the right patient at the right time by the right practitioner. If we follow all those things, our practice would grow. We can, make enough money if somebody is looking at money, or you can grow in your efficiency, effectiveness would be good, and you would get a good satisfaction that you have been able to manage single-handedly a lot of patients without moving out from your clinic or your home. So this is the ease at which we are. So the telemedicine is great that the doctor doesn't even have to change. So that's just the jokes. Thank you. If there are any questions, I'm ready to.
Audience, if you have any queries, please share either via the chat box or through
I think we can have the question after the second session.
Okay, sir. Okay.
Over to you, Dr. Rajesh.
Okay, let me introduce Dr. Rajesh Tipai. And Dr. Rajesh, he is our one of TSI Kerala chapter executive committee member, as well as he is the chief operating officer of BMH Jim Care Hospital, Kannur. And he is in our team for Telemedicon 2022. And I am happy to welcome you, sir, for this wonderful session. On his topic is how remote patient monitoring is changing healthcare services. Okay, I hand over the mic to Dr. Rajesh, sir. Welcome you, sir, to this session.
Thank you, Neeta madam, and Vijay and Uma Shankar. I think Dr. Uma Shankar covered very, what do you say, the whole gamut of telemedicine and how it is to be, practiced. I will so restrict myself to two specific areas where I'll go a little more deeper, and so that I won't be repeating what sir has already told. So anyway, I'll start by wishing all of you a very happy Diwali, and thank you for finding your time for this prelude to the Telemedicon. So starting with remote healthcare technology, as Dr. Mashankar said, why we need all this telemedicine is that because there is an increased life expectancy. I think at the time of independence, the life expectancy was 40 or 45, I think, and that is why the retirement age was also kept at a very low level. And even now the life expectancy has gone to 70, but still the government puts retirement age at 58 or 60. Cardiac disease is still the most common cause of death, though other causes are there in India, but predominantly across the world, cardiac disease is still the most common cause of death. And because of the age related factor, patients have got dementia, Alzheimer's, cerebrovascular accident, that is called a stroke, and then also neurodegenerative diseases, which causes prolonged morbidity and difficult for the patient bystanders to take care of their near and dear ones. So that is where healthcare technology, telemedicine, what we say, or M-health, we can say, that will be useful. And technological advancement helps in treatment of all these diseases and gives very good qualitative care within the home environment. And if you look at some of the components of this remote health monitoring system, mainly there is a sensing mechanism proximal to the patient, which will acquire the vital monitored parameters like BP, blood sugar, movements, if there is any seizures. So all those sort of activities are monitored. Then there is a remote server or a doctor's interface where the data that is collected goes to the doctor through a PDA or personal computer, and there is a secure communication gateway linking the both infrastructure. Now I would restrict myself to the medical part, because the technical part or the engineering part, I think Bijoy may be the better person to talk more on that. So I will just tell that these are the three pillars for having a good remote healthcare services. So doctor sitting at the hospital or even at home, he can look at the parameters and then give advice to the patient on a daily basis, or if required more acute illness, he can give hourly basis, he can give advice. So what is the benefits to the patients? The benefits are mainly logistical convenience, that it helps them to reduce unnecessary travel. Today travel in any part of a major city, in metro cities, is a horror by itself. Either you will fall in a pothole and you will get injured, or even be run over, any extreme situation. I'm just joking, but that is a fact of the life. Or you get exposed to pollution, and there is a very big traffic jam and a lot of issues. It is also cost effective, since it helps reduce the expenses towards hospitalization and intervention, because timely medical help will prevent further complication. Wireless sensing and computer-aided technology is there to provide proactive clinical intervention, and maximizing number of patients being treated at home across a wide spectrum of population helps to treat conditions like heart failure or a Parkinson's disease, and even stroke rehabilitation to a large extent. So these are the various things, some of the things already explained by Dr. Shankar. So we can look at EEG, which can be monitored, ECG, blood pressure. Then you can look at postprandial blood sugar. Then gyroscope, you cannot see here, gyroscope, and there is something called the EMG for the foot. And this goes into the personal digital assistant, goes to cloud, and then to the clinician. Or if there is an ambulance situation, it goes again the same pathway to the doctor. So the Internet of Things, has helped to get these data from ECG, EEG, whatever it is, and vital signs, blood oxygenation, body temperature, etc. And all these can be converted into a typical wireless body area network system and transmitted to the doctor. Now, various companies are here who do this help in remote monitoring system or assisted living technologies like BeClose, Fade, Medisafe. I don't know how many of them are in India. I have taken these details from a, international book, written by a foreign author. So Apple Watch, I think we are familiar, which will monitor the cardiac parameters and kinematic information. So these are all the wearables which are available, and and soon I think there will be Indian models available for patients in India. Now, coming to, as I mentioned, I'll focus on two specific things. One is cardiac patients and a few of their illnesses which can be monitored and remotely, and how it helps the patient. And secondly, some geriatric patients, how we can help them with remote monitoring. Now, what is telecardiology, wireless telecardiology? So wireless telecardiology is one of the most highly developed technologies. It's both non-invasive and invasive medical signals are available for healthcare. Most are recorded manually by the patient via a device like a systolic, diastolic pressure, the pulse, 3-lead ECG, heart rate variability, body weight, oxygen saturation, natriuretic peptides. All these can be done at home, either by the patient or by the relative, and then passed on to the doctor. Others we can obtain from invasive devices like impedance, incidence of arrhythmias, pulmonary, and left atrial pressure. We can monitor that, and that can be used to take decisions on what medicines to be given or what action or clinical action to be taken, course of action to be taken for the patient. In addition, it gives provision to care the patient with heart disease and also a vital role in educating the patients. How it helps, I'll come. Like a patient having acute coronary syndrome, telecardiology is very important in it. Now, patient may have ST elevation MI, or which is can be understood by the a health worker, as sir earlier said. So somebody like a health worker who can go to the patient's house on receiving a info on ST elevation MI, and transport the patient to a PCI center in due time. And there is a golden hour, everybody knows, to that within a certain time, if you come, you can do a primary angioplasty, and beyond a certain limit you cannot do it. So initial diagnostic modality is definitely a ECG, and ECG is recorded in the ambulance and transmitted to the PCI center. And ECG recording is interpreted by on-call cardiologists, and after consulting with the paramedic, a decision is taken whether to do a primary PCI or go to the local hospital. We do not delay the treatment. They can go to the local hospital and give a pharmacological therapy like streptokinase or other urokinase or tenectase. All other therapies are available. So here, patient having chest pain, then ambulance services alerted when an ECG changes seen, then the doctor advises, and either they come to the PCI center, or they go to a nearest hospital for a pharmacological intervention. So all studies prove that the ECG teleconsultation is technically feasible either from a moving ambulance or from remote places. And ECG teleconsultation allows faster triage, shortens the door to needle time, and reduces in-hospital delay. So even before the patient coming to the hospital, we have already decided what is the course of action. And in US, the paramedic is trained even to give pharmacological therapy in the ambulance. So that is an advanced way of managing there. So it lowers the rate of false negative diagnosis in the case of STEMI. So teleconsultation, the ECG is read directly by the cardiologist and not by anybody else. So we can, avoid false negative diagnosis, and that is a great advantage for the patient. So pre-hospital diagnosis is done, and the favorable outcomes is patient gets favorable outcome because of this pre-hospital diagnosis, and less impairment of ejection fraction and shorter length of stay, reduction in early and late mortality. So in conclusion, really, cardiology in acute coronary syndrome enables rapid reperfusion therapy, either pharmacological or mechanical intervention, thereby reducing treatment delay, morbidity, and mortality. Now, another condition is chronic heart failure. Now, patients who are having, heart failure, they tend to stay in the hospital for a long time. Now, it is not a good, practice, because as earlier, Dr. Uma says that patients have possibility of getting, hospital-acquired infection, and many of these patients are above 65 years of age, and they have that risk of hospitalization is very considerable. Effective use of telemedicine in heart failure patients has been now expanding worldwide, and you can reduce hospitalization and also increase survival among the patients managed by telemedicine. Here again, same way, the ECG, pulse, blood pressure, and blood glucose, body weight data goes through a gateway, and it goes to the doctor directly, and then the doctor gives an onward transmission to the professional network of chronic illness, or he gives advice to the ambulance service and says bring the patient in, or he can give the feedback, clinical feedback back to the patient. So this is the way a telemedicine can help in chronic heart failure patient. So patient gets a better understanding of their disease, and they are more responsible for monitoring and managing their own illness, and it enhances their empowerment. Psychological interventions also can be given to them as a part of cognitive behavioral therapy and mindfulness exercises, so that their anxiety is reduced, depression is reduced, and clinical symptoms, these are the clinical symptoms which are common in heart failure patients. So telemonitoring in heart failure reduces the cost and increases the revenue, but also saves lives and prevents the complications by improving patient safety and quality of care. Same is the, another situation in cardiac patients is telecardiology for arrhythmias and cardiovascular implantable electronic devices like CRT-D device or AICD device. See, these are, number of patients with all these devices have increased tremendously in the modern era. And these CIDs are managed through several mechanisms. Conventional follow-up is hospital-based, and visits which requires patient to travel for the assessment and optimization of the device function. So these are time-consuming, burden to the patient, and waiting time, etc. So remote monitoring has shown to be beneficial impact on survival, and remote monitoring can reduce reduction in inappropriate ICD shocks. So for patient, this remote monitoring is a valuable tool and assist in diagnosis of arrhythmias or ECG abnormalities. Again, here the use of telemedicine comes. Implantable cardiovascular defibrillator is connected to a phone or internet connectivity, and through a satellite to the telemedicine center and to the doctor. And from there, the advice goes back to the patient, and they are monitored through the through this same pathway. So symptoms secondary to arrhythmias like palpitation and syncope can be documented on ECG tracings, but many ECG tracings are very transient and paroxysmal. So just like we do the 24-hour monitoring of patients ECG, like for Holter, this sort of arrhythmias can be missed even by long-term Holter recordings, but in tele cardiology these can be picked up. So using of remote device enables real-time cardiac arrhythmia monitoring and also provides specific diagnosis, recommendations for actions, and also gives rate of diagnosis and efficacy of treatment. So in addition, patients, it enables the patients to undergo dose titration of their medication and avoiding unnecessary travel to the hospital. And it's also advantages in paroxysmal AFs because alerts can be identified as the start point of arrhythmia, resulting in unscheduled follow-up or and doctor can give advice by phone. So I think this is the same which I mentioned earlier also. Now coming further away from cardiac, we can just see how elderly people can be benefited by remote monitoring. Now fall detection is a very important problem in the elderly, and a lot of research has gone into it. Falls are a prominent cause of injuries in patients and related to injuries which are related to deaths today. And older adults have got major health risk even in the most ordinary settings of daily life. So according to WHO, a fall is defined as inadvertently coming to rest on the ground or floor or other lower level, excluding intentional changes in position to rest on furniture, wall or other objects. So approximately 1/3 of the dwelling residents above 65 years at least fall once a year, and with the chance of falling increasing with age. And in the West and now also in India, where is this parents being left alone to take care of themselves, and very many families have becoming nuclear families, and the elderly are finding it difficult. And the West it is very much a norm that elderly parents are to live alone. Very rarely they have their children taking care of them. So here for them a fall is going to be a big problem. So the focus is on developing protocols for assessing fall risk by use of body-worn inertial sensors, pressure mats, and motion capture systems. This is a very advanced, technologies they use, and they are doing something like deep learning, and much research is going on these sort of technologies. So medical engineering is looking into this and how to develop a sensor which can be triggered when there is a changing position, and and so there are different methods by which fall risk assessments are done, and the research is still going on how to improve. Personal alarms are one way of it, most basic one, reducing the impact of the fall. So where the wearer can use a call for help alarm, so it gives some peace of mind, so he can press somewhere and if and a bell or something, and somebody gets alerted. So this will reduce the occurrence of long lies after a fall, where the faller is unable to get up after several hours, or whether he can get some help from another healthcare worker. Wearable button activated alarms that can communicate with emergency services are already commercially available. So this is some of the devices which are there. This watch like system can be worn by the patient, and the alarm system with the care worker or within the house, and it can transmit to the care worker. So these are the things which I was telling earlier. We had seen this accelerometry and gyroscopy, which are complex instruments, and still in a experimental stage, and wearable sensors are also in the experimental stage for the patients. Other thing which which has been done with a lot of research is going on is how to monitor activities of daily living. This is human activity recognition. Is a well-researched topic, and it's also looking at signal processing methodology and sensing techniques, and environment from where activities acquired. I think Rajiv Patni raised a hand. Is it for a question?
No, sir, it was initially like that.
Okay, okay.
No, you can continue.
Yeah. So now key research in this human activity recognition are key steps in this are, one is activities are to be monitored, what type of sensors we are going to use, and the methodology to determine or classify the activities performed, embedded implementation of low complexity algorithms for real-time information extraction, and reconfigurability of the system. It's all very complex. Even I am finding it too. I think Bijoy, you should help me here because this is a really more of engineering than pure medicine. But the advantage is definitely for the patient. How it helps, I'll come to that. I think I will not go more into the complexity of this thing. But what it measures is the acceleration, the distance, the rate of rotation, the time, etc. of the patient, or patient hand movement, and which act as health indicators for gait. In a stroke patient, it can be a gait or the posture of the patient, whether it's having tremor and spasticity, that is for Parkinsonism patient, and this all helps in clinical assessment. So in addition to this, the inertial measurement units, which is what is the word they use, these smartphones are giving us access to wide range of built-in sensors such as Bluetooth and Wi-Fi, microphones, etc. All these are helping. Now with 5G coming into the picture, I think this level of technology is just going to be more and complex and more advanced. So this is one Samsung phone which has been attached to a patient's elbow joint for detecting the activities of his arm. So this is part of improving his strength of the arm. So with that, I would come to the end of my talk. I know it was a bit of tough technology related topic, but finally these technologies are going to be here, and they are going to be again more advanced day by day. And like you have tele ICUs, tele, radiology, telepathology, tele ophthalmology. All this, I think, is there, going to be there, and it has coming in a big way and going to advance within the next decade. And finally, it is going to benefit the patients, and it is going to reduce the cost of care. Though you may think buying certain devices may be costly initially, but in the long run, definitely the quality of care will definitely help, and for both the patient, and gives a lot of time for doctors also to to plan the care for the patients. Thank you so much for your patient listening.
Thank you, Dr. Rajesh sir, for the wonderful speech, and you have enlightened with all the research aspects of telemedicine, and also you talk about some of the wearable technology and future scope of this area, so that engineers like us can also contribute in that. We are happy, very happy that anyway you.
Sorry, madam, I
this.
didn't know you were from engineering.
Yeah, I am basically a biomedical
I think
engineer.
half of the things which I spoke was more of engineering.
Yeah, but initially it was so that more of the engineers should contribute to the biomedical sensor area.
Very
And
true.
also application development for the mobile based
Yeah.
thing. Anyway, software engineers also need to contribute a lot to that area. And also some wearable thing and all. So mechanical engineers also must
Yes.
contribute to that
Very
area.
true. Very true.
Yes. Thank you for the wonderful speech. And we are having some queries, and I will read out those things.
Okay.
1 minute, sir. One question is from Mr. Arun Sahu. Is telemedicine effective for first-time consultation? The doctor needs to check the physical status or condition of the body physically. How is it done online?
So, is it okay?
Uma Shankar,
I
sir,
think Dr. Uma, yeah.
Uma Shankar,
okay.
sir, can.
See, telemedicine consultation can be done for first or follow-up consultation. It is not, it is actually, people think that it is not for first consultation, it's only for follow-up consultation. For basic consultation, wherever the patient need not be examined, not necessarily every time we are examining the patient. Most of the time, only with the symptoms, what the patient says, the signs, what we observe, only with that we can diagnose the case. If at all we need a physical examination, if the patient is very far, we can ask that nearby, the patient can go to a nearby center and get it examined, and we can have a discussion with that particular doctor or a healthcare provider and provide the consultation. So it is effective. It is not that only second time telemedicine effective. Telemedicine is effective even in the first time consultation. I can give n number of examples where we have been able to save lives in emergency situation, even in first consultation, as well as the patient did not even have to travel to the hospital. Just with teleconsultation, we have been able to manage the patients. I hope that clears the question.
Okay, sir, there are a lot of queries, but we can, due to time limitations, we can skip and only read out some important one. And out of 6 types of telemedicine, which is the most suitable in Indian conditions? That is another question asked by Dr.
It is not
Atul Bhatt.
that it depends on where we are going to use it, whether we are going to use in rural telemedicine and what is our ecosystem in which we are. All the 6 types are necessary for Indian scenario or any scenario. But where we are going to use it, according to that, we'll have to select. Suppose we have a rural area when people may not have smartphones or something like that. Nowadays, everybody has a smartphone, but most of them may not have. So in such places, you can have a rural center or you can have a kiosk or something like that. Where in urban cities, you don't need a kiosk or something. You can have, everybody has a smartphone, they can consult, or they have internet connectivity is very good, so we can have. So according to, depending on the ecosystem, depending on where we are, where we want to establish the telemedicine, we can decide on that. There is nothing like this is the formula. So it is always, we have to assess the current situation and then decide what kind of telemedicine we have to use. If you ask for country, I would say all are necessary.
Okay, sir, another question is remote service, what are the major challenges at the ground level in using telemedicine? That is also asked by Dr. Atul Bhargava. And one more question is, there is a growth in telemedicine market around 25%, and which factor is contributing most? Is also asked by Dr. Atul Bhargava.
Okay, and now, so let me come to the question of, is remote service, what was that? The first
what are the major challenges at ground level?
challenges, what are the ground level?
Challenges.
So obviously, when we are using something new or a technology, even we have challenges everywhere. The major challenge, what we have seen, is the technology. Technology is, we say, boon and bane both. So one is the connectivity is not there everywhere. That's one of the major challenges what we have. Even if we have connectivity, we might not have selected appropriate technology. That's another problem. And even if we have selected appropriate technology, we may not have somebody to use it. So, and there are like that, there are various challenges. And when it comes to technology, if you procure, we are advancing so much that today I procure something, tomorrow there is a change in that. So we have that obsolete things in the technology which is coming. And the cost is also one of the challenge. It looks like that initially there is a huge investment, but when you look at the long run, what we are investing in telemedicine is not. For the kind of returns what we get, it is good. Sometimes it is always, people also look at the challenge is that because we look at it as a business. When somebody looks at it as a business, that I have invested so much, I'm not getting returns in this way. It is not, some people may say that, but definitely there are returns. You may not, and I would say that it is always not in returns in terms of money. There are various other returns. So this is one question which I have faced over 20 years, especially with the hospital management. See, this much I'm investing, and what is a return on investment guarantee? So return on investment is not always in terms of money. The patient, what comes to you, is also an investment. The return on investment what you get. So like that, there are various challenges. The ground level challenges is basically at the technology level, I would say. And people still have a myth that I have to, especially in the rural area, if you go, we have seen unless you prick an injection, people will not be satisfied. So patient think that they need to be touched, they need to get an injection. With telemedicine, we cannot give an injection, because we generally don't prescribe injections or kind of thing, because there may be some kind of a reaction. At the other end, if it's a healthcare provider, then it's fine. If the healthcare provider is not there, then it is not. So these are some of the ground level challenges.
Okay.
What was
Thank
the
you, sir.
second question?
Thank you. Vijay sir, do you want to say something?
See, when the major challenges, you can say one thing is the adaptability, and this is we can say this is a transition period of from the the doctors who were not literate in the system side, and now the next generation, they are coming up with they started playing with the smartphones, and so this is a transition period. So we are in between this transition period, and maybe now the technology is being slowly started adopting by the doctors, and this will be I expect this to be a part of their life, going to be a part of their life within a short span of time, because that is what is a major challenge, I believe.
Okay.
Yeah, thank you.
Thank you, sir. Thank you for the answer. And there is one question to Dr. Rajesh sir. Apple company develop watches to record activity, pulse, even ECG, but very expensive to common people. So how can we
And that
reduce?
is actually you have to help us.
Yes, engineers.
Exactly. That
Uh,
question is no direct to actually Dr. Nita. She has been working with sensor technologies in Sri Chitra, and yeah, she
Yes.
knows. So she's the
Actually,
right
indigenous
person.
development must come into picture, and in Kerala also there are a lot of efforts are taking to develop that. In India also, e-Sanjeevani, all those things are happening, but to common man and utilizing the market, anyway, somebody has to do it, and they have to. Government of India or such organization must do it and handle the technology to some companies and help them in developing such devices. So that definitely, like heart valve reduces their price, implantable that pacemaker reduce the price when indigenous development comes. Like that, definitely that foreign companies will definitely reduce the price, and it can be accessible to common man. That is my answer. Okay, next question is, what telemedicine type is better significance in cancer care? It is asked by administrator from RCC, Mr. Mithun. So I share this question. Either Dr. Rajesh
yeah,
sir or
it is beneficial in all category of patients. They need not travel, as I mentioned. Patients can be at home and avoid visiting the hospital. That is the best for patients who are immunosuppressed, and for minor things they'll come to the casualty and get admitted, and then they may get an infection. Those things can be avoided. So patients who are on chemotherapy and follow will definitely benefit from this sort of telemonitoring and remote monitoring of patients.
there are a lot of questions, but my humble request is that all of you attending these sessions, please do register for our Telemedicon 2022 so that you can have a lot of people, you can ask many questions, and that is my humble request. So I hand over the mic to Mr. Soumya to conclude the session, and I hope all the questions answered.
Thank you everyone for joining us today for the Prelude session for Telemedicon 2022. I would request doctors who have joined today can also participate for the offline session for Telemedicon 2022. I have actually posted the registration details in the chat box, so the registrations can be done accordingly. Also, in case if you require any sort of assistance for participating in Telemedicon, can reach me. You guys know my email ID and mobile number. I will help you with the registrations. And thank you, Telemedicine Society of India Kerala chapter for supporting to implement and support doctors to implement telemedicine practices effectively. We look forward to your continuous participation. Thank you so much.
Thank you. Thank you, Soumya, for conducting this program. And thank you, dear all participants. And lastly, I request everyone to join the conference. Register now. We can meet and discuss and network in our Telemedicon. Please do visit us. Please do come. Register now. Thank you very much.
Thank you all.
Thank you.